Hi there, I'm Dr. Eric Hefferon with another Impact Mobility Tip of the Week. Today we're talking about post-surgical shoulder pain and limited range of motion. So if you had arthroscopic surgery or rotator cuff or labral repair, anything under the sun where you just got out of surgery and obviously you're having a more difficult time raising your arm above your head, this could be an awesome strategy for you. Or you physical therapists out there that are struggling with coming up with exercises for a patient to do. Instead of forcing their arm overhead, this can be some other strategies. So, like I said, you may be in a sling, you might have a lot of pain and inflammation, so you have a very difficult time raising your arm above your head. These can be some great strategies for you. So what I challenge you today is that instead of forcing it over and over, the distal segment, this part on a proximal area, so distal and proximal, where I'm moving this up on the humerus on the glenoid, so I'm moving the humerus. Most people are going to have a very, very difficult time doing that. Even if it's assisted with something else, it's very painful, especially in standing against gravity. So I challenge you to think about the opposite. Keep this segment, the distal segment or the humerus, fixed and move the glenoid or the scapula on a fixed humerus. That can help yield a lot of range of motion. So let's say that I could get it at partial range. I may want to put it up on a true stretch or on a table and leave this segment straight. And if I'm trying to gain more shoulder flexion, so straight up and down, I could keep this segment stable or even put it on a table, and I can move my lower half on a fixed humerus. So I could be here, and I could even do some mini squats this way. So that obviously regain more shoulder flexion. It can be a lot more comfortable than moving the distal segment against gravity. So put it up on a stable surface, move your lower body, plus they're working in their quads, they're working other muscles too as well, but that may help regain shoulder flexion. Increase the height as they tolerate it. You can even try to get end range flexion. You can bring them up higher here and then move their lower half to allow for that normal slide and glide to regain shoulder flexion. Use that same principle for other ways. If you're trying to go abduction or abduction, very, very difficult after surgery. So instead of making them force it way up there, think about having this arm fixed and then moving the more proximal segment on the distal so we can even squat down this way or lean down this direction to gain more abduction. Same thing for internal external rotation. Put the arm here, move their body on a fixed arm, internal rotation, move it out this way, external rotation. Try that, great clinical pearl, probably get you pretty far. So if you're a patient or physical therapist, give it a try. If you get a lot of pain, definitely reduce down, but can be in more strategies to be successful in your rehab. Have a great day.